Have you ever felt like your body was resisting something, even when your mind said it was okay? For many women, painful or impossible vaginal penetration isn't just uncomfortable. It's confusing, frustrating, and often never talked about. This could be something called vaginismus, and it's more common than you think. Let's talk about it. Vaginismus is a condition where the muscles around the vagina involuntarily tighten whenever something tries to enter, a tampon, a finger, or during sex. It's not just in your head. These are real physical spasms caused by a combination of physical, emotional, and psychological triggers. There are two types: primary vaginismus, when it's been present from the first attempt at vaginal penetration; secondary vaginismus, when it starts later, often after trauma, childbirth, surgery, or hormonal changes like menopause. Symptoms can range from mild discomfort to intense burning or tightness. Some women feel like they're hitting a wall. Others feel fear, pressure, or even shame during intimacy. But here's the truth. This is not your fault, and you are not alone. Vaginismus doesn't always have a single cause. Some common factors include physical pain from past infections, injuries, or surgeries. Emotional trauma, like past abuse or negative sexual experiences, can also play a role. There are psychological triggers, including anxiety, fear, or deep-rooted beliefs about sex being wrong or dirty. And even relationship stress or religious upbringing can contribute as well. A pelvic exam from a compassionate provider can help rule out other issues. And honestly, many doctors now use numbing creams or alternative methods to make the process gentler and more comfortable. The key is open, honest communication with your doctor and with your partner. The good news? Vaginismus is treatable. Many women heal and go on to enjoy fulfilling, pain-free intimacy. Treatments include topical creams to reduce discomfort, pelvic floor physical therapy, and exercises like Kegels, and vaginal dilators to gently stretch and retrain the muscles. CBT or sex therapy can help rebuild trust and reduce anxiety. And yes, all of this can be done at your own pace, even from the comfort of home. You deserve to live without fear, without pain, and with full confidence in your body. If you or someone you love is dealing with vaginismus, speak up. Healing starts with understanding, support, and action. You are not broken. You are powerful. And healing is within reach. Subscribe to Healthy Bytes for more honest conversations about real health topics. Let's remove the shame together.